Hello, and welcome to Chapter 1, your very first day of CNA training. I am so excited that you have chosen advanced care to help you prepare for your future in healthcare. My name is Lakeisha, and I will be your instructor for this lecture. We are going to begin in Chapter 1, which talks about the nursing assistant in long-term care. Now, here are a few tips to be successful in this chapter. You definitely want to have a notebook, a highlighter, your book, and a note, a notebook, something to write in, something to write with, and a highlighter. I'm going to go right along in your book, starting on page 1. I want you to highlight things that I tell you is important to highlight and take as many notes as possible in your book. And as your instructor, I am always available to you if you have any questions. All right, so let's begin. We are in Chapter 1, page 1, which talks about the nursing assistant in long-term care. And so I want to start off by saying, welcome to the wonderful world of healthcare. And we know that healthcare can happen in many places. So we're going to explore some of the healthcare settings in which you as a nursing assistant can work in. However, this program will only focus on long-term care settings. It doesn't mean that you can't work in other healthcare settings, but traditionally, nursing assistants are trained to work in nursing homes, or what we also call as long-term care facilities. So first, here are some terms to become familiar with to help us understand long-term care. So I really want you, and again, I'm on page 1, I want you to follow along in your book and highlight in areas you need to highlight. And feel free at any time if you need to pause the video, rewind, or replay again, whatever you need to do to make sure that you understand everything that we are talking about today. So the first term is long-term care. Long-term care is care that is given in facilities for people who need 24-hour skilled care. So I kind of look at long-term care as you're not sick enough to be in a hospital setting, but you're definitely not well enough to be home. And you need to be in a facility where there's 24-hour skilled care. So places like a nursing home or an extended care facility. And so what is skilled care? Skilled care is medically necessary care given by a skilled nurse or a therapist, which we will talk about in shortly. The length of stay is the number of days a person stays in a care facility. So one thing to understand about long-term care, hence the word long-term, these residents or patients are in these facilities for a long period of time. It can range from a month to several years and beyond. Now, terminal illness is a disease or condition that will eventually cause death. The term chronic means long-term and long-lasting. And what we're going to be talking about in this section, in this chapter, and all throughout the program, is we're going to be caring for those who have chronic diseases. And those are the diseases that are long-term and long-lasting. The next term is diagnosis, and those are medical conditions that is determined by a doctor. And so what happens in any type of healthcare setting, in order to even just qualify to be admitted or to stay overnight in any healthcare setting, you have to have a diagnosis. There has to be something wrong with you. And those are medical conditions that is determined by a doctor. So now let's begin to explore where healthcare can happen. The first setting is what we call home healthcare. That is healthcare that is provided in a person's home. Assisted living are residences for people that do not need 24-hour skilled care, but they do require some help with their daily care. Adult day services are care for people who need some help during certain hours, but who do not live in the facility where care is provided. For example, it's similar to that of a child day care services where during certain hours of the day, your child is in the hands or care of other people while the loved one or the parent works. And so that is the same for elder adults. The next setting is acute care. That is 24-hour skilled care given in hospitals and ambulatory surgical centers for people who require short-term immediate care for illnesses and injuries. So if you think about some of your big healthcare systems here in Michigan, we have Ascension, we have Beaumont, which is now Cornwell, we have the Henry Ford Health System. Those are all considered acute care facilities. Then you have something called subacute care. That's care given in hospitals or in long-term care facilities for people who need less care than for an acute care or acute illness, but more care than a chronic illness. Our next setting is what we call outpatient care, and that's care given to people who have had treatments, procedures, or surgeries and need short-term skilled care. You can also kind of look at this like your outpatient surgical centers, your physician offices, your treatment centers, and things like that. Rehabilitation, this is important. So you definitely want to highlight rehabilitation as well as long-term care, which we talked about previously. Rehabilitation is care that is given by specialists to help restore or improve function after an illness or an injury. And then hospice care, which goes along with the term that we just talked about, which is terminal illness. Hospice care is holistic, compassionate care given to people who have approximately 6 months or less to live. So now let's talk about people who actually live in long-term care facilities. These people may be disabled. They are often elderly. However, younger adults sometimes require long-term care too because of the chronic conditions. People who live in long-term care facilities may arrive from hospitals or other healthcare settings. And then often they may have chronic health conditions such as heart disease, physical disabilities, or dementia, which we'll talk about in later chapters. So here's something to remember. Long-term care facilities are the resident homes. And so nursing assistants can help residents feel at home by respecting their space and their privacy. So because we're dealing with long-term care facilities, which is considered a resident's home, we're now going to refer to our clients or our patients as residents because this is their personal space. Now, let's look at what is a typical long-term care facility. So one of the terms I want you to be familiar with is what we call activities of daily living, and we abbreviate that as ADLs. And what that is daily personal care tasks such as bathing, dressing, caring for skin, nails, hair, and teeth, eating, drinking, walking, transferring, and elimination. Now, this is important and it's on page 3. This is very important for you to highlight because one of the main roles or duties of a nursing assistant is to perform activities of daily living. Now, also in long-term care facilities, there are other services that is offered. For example, assistance with personal care. You will also see physical, occupational, and speech therapy. You will also take care of residents who require wound care. You will also be caring for people who have different types of tubes. You will also be caring for those who needs nutritional therapy, and then also for management of chronic diseases. Now, different long-term care facilities may offer different services. So it's important that places where you're going to apply for a job, You want to ask those questions. What are some other services that are offered along with the long-term care facilities? Some may offer specialized care for residents with dementia. That is a specialized unit. Some may include assisted living facilities, and others may also include resident apartments. If a facility provides any type of specialized care like dementia services, then employees will need to be specifically trained to provide care to that population. Now, as we're getting a little deeper into a typical long-term care facility, there are two terms that I want you to understand. The first one is person-centered care. That's a type of care that places the emphasis on a person needing care and his or her individuality and capabilities. When caring for residents, you will be taking care of those who may have had a history of trauma or other experiences that could impact their care. So it is important to honor your resident preferences and also listen to what's being communicated. And that leads us to our next term, which is trauma-informed care. It's an approach to patient care that recognizes that people may have experienced trauma in their lives and that their trauma experiences and preferences should be considered while providing care. Now we're going to switch gears a little bit and we're going to talk about what are some things that drives healthcare. So there are two terms that you may have heard of before. Medicare is a federal health insurance program for people who are 65 or older. They may have certain disabilities or permanent kidney failure or are ill and cannot work. Medicaid is a medical assistance program for people who have low income as well as for people with disabilities. So here are some facts about Medicare and Medicaid. Medicare is also broken up into parts. You'll see Part A, Part B, Part C, and Part D, and each part plays a role. And then Medicaid, again, is for those who have low income as well as for those who have disabilities. And then people qualify based on their income or special circumstances. So here are some things to really think about. How much would it actually cost to live in a long-term care facility? It can vary. But it's important as a CNA to really know that stuff because you now know what some of the strain and some of the changes or some of the issues that your residents may have. Financial issues. Long-term care facilities are very expensive to live in those facilities, and they're paid on a fixed amount for services. And so they can range anywhere from $3,000 to almost $25,000 a month for those residents. And this can be out of pocket if it's not covered by Medicaid, because again, Medicaid is going to be for skilled services. So that's going to be for services that's only provided by a nurse or a therapist. And so services are based on the resident's needs upon admission and throughout their stay at the facility. Now, let's begin to describe the nursing assistant's role. And this is very important because this is who you are and what you contribute to the healthcare team. Long-term care facilities may use any of the following titles for nursing assistants. For example, it can be a nurse aide, it can be a certified nurse aide. You are also referred to as a patient care technician, as a certified nursing assistant. But for this textbook, we're going to use the term nursing assistant. Now let's discuss further the role of a nursing assistant. Nursing assistants perform assigned nursing tasks such as measuring and recording temperature, measuring and recording a blood pressure, counting and recording pulse and respirations, which is breathing, observing and reporting about pain levels, bathing residents, and this is going to be some of the personal care that you're going to be providing, assisting residents with hair care and other grooming tasks, helping residents dress, helping residents with mouth care, helping residents with elimination needs. And then also the nursing assistant jobs may also include the following: assisting residents to move around safely, keeping residents' living areas neat and clean, assisting with meals, caring for supplies and equipment, making beds, and possibly giving back rubs. Now, in addition to the nursing assistant's role, there's another part of your job that's very important and very key. It's called charting. And charting is documenting information and observations about residents. And you can see this, you can follow me. I'm right on page 4. Charting is very, very important. We're going to dig a little bit deeper into charting towards the end of this chapter. Now, nursing assistants are not permitted to do any of the following. You are not allowed to insert or remove tubes. You are not allowed to give tube feedings, or you are not allowed to change sterile dressings. Now, some states allow nursing assistants to give medications if they have completed an additional specialized course for medications and meet the requirements of the individual facility. And Michigan actually is one of those states. We have many nursing assistants that work in assisted living facilities that actually pass medications in addition to giving care. Remember, nursing assistants spend more time with residents than any other care team member. Nursing assistants' observations are very important in making sure residents receive the best possible care. You are the eyes and the ears of the healthcare team, and we depend on things that you see first. So it's very important that throughout the day when you're caring for your residents to make important observations. Now, don't worry if you don't understand what's normal versus what's abnormal. That's what we're here to teach you throughout this program. Also remember, all residents are the responsibility of each nursing assistant. If a nursing assistant sees a resident who needs help, you must help. Even if that resident is not assigned to you, you are still responsible for helping or assisting that resident. Now, let's begin to describe the care team and also the chain of command. Resident care is provided by a care team made up of the following team members. And so I've already talked about the nursing assistant. You know exactly what your role is. Other members on the care team is a registered nurse. On page 5, you can read the description of the registered nurse. But we know in long-term care facilities, a registered nurse coordinates, manages, and provides skilled nursing care. This includes giving special treatments and medication as prescribed by a doctor. A registered nurse also assigns tasks and they supervise daily care of residents by nursing assistants. So it's very important to understand this. At any moment, if you have any issues with your resident or anything concerning the resident or care team, you are always to report to your nurse. So I want you to keep that in mind. That is your charge nurse, that is your supervisor. You are always to report to your nurse. And this is good for testing purposes as well. Always report to your nurse. The second person on the care team is your third person is your licensed practical nurse or licensed vocational nurse. We also know them as the LPN. Now, your licensed vocational nurse is responsible for giving medications and treatment as well. These are licensed professionals who have completed 1 or maybe 2 years of education and have also passed a national licensure examination, but their focus is also just to give medications. Now we have advanced practice registered nurses. An advanced practice registered nurse is a registered nurse who has completed training at the postgraduate level, master's or doctoral. These are people that are nurse practitioners and beyond. Also, physician or a doctor is on your care team as well. A doctor is a licensed professional who diagnoses disease or disability and prescribes treatment and medication. And for nurses, we receive our orders from doctors. Who else is on the care team? We have what we call a physician assistant. That is a licensed professional who also diagnoses disease or disability and can develop a treatment plan as well as prescribe medication. A physician assistant works under the supervision of a doctor. Now, this next team member, what we see is a physical therapist. I want you to go ahead and highlight that. because we talked about rehabilitation earlier as one of our terms in one of our healthcare type settings. Physical therapists are also available to give skilled care, and you're going to work very closely with them. A physical therapist evaluates a person and develops a treatment plan to increase movement, improve circulation, promote healing, reduce pain, and also to prevent disability. Then we also have an occupational therapy. Highlight this team member as well. An occupational therapist helps residents learn to adapt to disabilities. For example, if you have a resident who has had a stroke, and let's just say, for example, their right side has been affected, and their right side actually could have been their dominant side. Your occupational therapist is going to train them to adapt to their disability. In other words, they're going to show them how to function, perform ADLs and such with their left side. So they're teaching them how to adapt to their disability. And they do this by using devices called assistive devices, which are special equipment that helps a person who is ill or disabled to perform activities of daily living. We're going to get a lot more into this when we go into chapters 9. Other care team members is your speech language pathologist. A speech language pathologist or a speech therapist identifies communication disorders, addresses factors involved in recovery, and also develops a plan of care to meet those goals. Other disciplines is the registered dietitian. A registered dietitian or nutritionist assesses a resident's nutritional status, and they also develop a treatment plan to improve their health and manage illnesses. A registered dietitian creates diets to meet residents' special needs and may also supervise the preparation of food and educate people about nutrition. A medical social worker, which you can highlight as well, is a medical social worker determines residents' needs and helps get them support services such as counseling and financial assistance. They may also help residents obtain clothing and personal items if the family is not involved or does not visit often. So I like to kind of sum up their role as resources. They have many, many resources for your resident. Other people on the care team is the activities director. The activities director plans activities for residents to help them socialize and to stay active. These activities are meant to improve and maintain residents' well-being and to prevent further complications from illness or disabilities. Games, performances, and arts and crafts are some type of activities that the activities directors may plan or lead. And then you have the residents and the resident's family. The resident is an important member of the care team. In fact, they are the most important member of the care team because without your resident, it would not be us. Providing person-centered care means placing the resident's well-being first and giving them the right to make decisions and choices about their own care. The resident helps plan care, and the resident's family may also be involved in these decisions. The family is a great source of information. They know the resident's personal preferences, history, diet, habits, and also routines. Other people that you may also see on the care team may be a dentist, which means they'll come in to kind of help take care of the overall oral health of your resident. You may also see a psychiatrist, which is responsible for developing treatment plans for mental health. And then lastly, a clergy or a priest is on the care team to kind of help meet those spiritual needs of your resident. So remember, the care team revolves around the resident and their condition, treatment, and progress. All members should focus on the resident, and it's important that all members of the team are able to communicate with each other. So now let's get a little bit further into the care team and also into the chain of command. Chain of command is the line of authority within a facility. I like to call it the reporting structure, and I'll show you an example of this in the next slide. Liability is a legal term that means someone can be held responsible for harming someone else. Scope of practice, which I really want you to highlight, is the range of tasks that healthcare providers are legally allowed to do according to the state or federal law. And then care plan is a plan that's developed for each resident to achieve certain goals. It outlines the steps and tasks that the care team must perform. So just like you report to your nurse whenever there's issues with your residents or with any members of the care team, you are to view the care plan before you begin to care for any resident. The care plan will tell you what tasks need to be done and who must perform those tasks. And it's very important to view that care plan. Let's say, for example, that you have a resident you've never taken care of before, and you know that you need to get that resident up out of the bed into the wheelchair and possibly give them a shower. Well, how does that person transfer? Does that person use a walker, a cane, or crutches to assist them with their mobility needs? You wouldn't know unless you look at the care plan first. So always, it's very important that before you perform any task, that you always view the resident's care plan. Now, here's an example of what the chain of command is all about. So you see yourself, nursing assistant, at the bottom of this structure here, or chain of command. And so what happens, it's teaching you who to report to in the range of the authority. So for example, nursing assistants may report to staff nurses. If there's a problem, your staff nurse is considered your supervisor, and we've already talked about their role. All right, your next person is your charge nurse, which goes hand in hand with your staff nurse. And then also you have a nursing supervisor who supervises and supports nursing staff of the entire facility or multiple units. And then you'll notice that as you keep going up, you have other coordinators, you have education coordinators, but at the top of this list in green, you have someone called the assistant director of nursing or the director of nursing, and they're responsible for managing the entire nursing staff. Now remember, each state has different laws, but some tasks are never performed by nursing assistants. Nursing assistants never make diagnoses or perform procedures involving sterile technique, for example. And also remember, a nursing assistant must never honor a request to do something outside of their scope of practice. You want to report such requests to the nurse. So remember, your scope of practice is a guide to let you know what you are able to legally do in any of the healthcare settings that you work in. So for example, you may want to review your job description as you are applying for a job and you're possibly receiving an offer. You want to really look at your job description, because that's considered like your scope of practice. What is it that I am legally allowed to do in this particular setting? Now, let's look at some points to remember about the residence care plan. The residence care plan is individualized for each resident. It is developed by a nurse to help achieve the goals of care. It lists the tasks the care team, including you, nursing assistant, must perform. It is a guide to help the resident be as healthy as possible, and careful nursing assistant observations and reporting can help make the care plan more effective. Now on page 7, all the way at the bottom, you'll see a paragraph that talks about care planning. Care planning should involve input from the resident and/or family, as well as from health professionals. Person-centered care places special emphasis on the importance of the resident's input, but also care planning is actually kind of like a meeting or a conference. And so what happens is you're gathered with your resident, and you as a nursing assistant will provide input concerning that resident's health, because remember, you spend the most time with those residents. Remember, tasks not listed on the care plan should not be performed. If a nursing assistant has a question about the care plan or thinks something is missing, you should talk to your supervisor immediately. Now we're going to switch gears a little bit, and we're going to discuss policies, procedures, and professionalism in the healthcare setting. A policy is a course of action that should be taken every time a certain situation occurs. A procedure is a method or way of doing something. These policies and procedures are common in long-term care facilities. All residents' information is confidential, and we're going to discuss that term shortly. Residents' care plan must be followed. That's something that we just talked about. Nursing assistants only perform tasks in job descriptions. Nursing assistants must report to a nurse. Nursing assistants should not discuss personal problems with residents or families. Nursing assistants should not accept gifts and money from residents or families. And nursing assistants must be dependable. These are policies and procedures that are very common, not only in long-term care facilities, but in any healthcare setting. Now, let's look at the following terms as it relates to professionalism. Professional is having to do with your work or your job. Personal is relating to life outside one's job, such as family, friends, and home life. And then professionalism is the act of behaving properly when working. And so as we continue our discussion on professionalism, here are some terms to describe the qualities a person must have to be a good CNA. The first is compassionate, being caring, concerned, and considerate, empathetic, and understanding. Empathy is identifying with the feelings of others. In other words, putting yourself in that person's situation. Sympathy is sharing in the feelings and difficulties of others. Tactful is showing sensitivity and having a sense of what is appropriate when dealing with others. And conscientious is guided by a sense of what's right and what's wrong. So it is important that as a CNA, you must keep your relationships with residents and your employers professional. So here are some points to help with that. These points will help nursing assistants keep relationships with residents professional. Always provide person-centered care. Be positive. Do only assigned tasks. Keep residents' information confidential. That word has come up twice. Confidential simply means private, but we're going to get a little bit more to that later in this chapter. Be polite and cheerful. Do not discuss personal problems. Do not use a personal phone in residents' rooms or in resident care areas. Now, we're going to continue with keeping relationships with residents professional. Do not use profanity. Listen to your residents. Call residents by their preferred and proper names, and that is important to highlight. What happens is, if you don't know what their preferred name is, you can always ask or you can refer back to their care plan. Do not accept or give gifts. Now, I know this is very hard because in the healthcare setting, we become very, very close to our residents, and it's very hard to not accept or to give gifts. It's very hard to not do these things, but it's important because you may be working with those who may have dementia. They may not even remember that they gave you something. And some of those behaviors that they display, they can accuse you of things. And so it's important to not accept or give gifts. Usually when a resident gives gifts or to us, what we usually do is we would share it with the entire staff. Other things to help keep the resident relationship professional: always explain care before providing it. And then follow facilities care practices such as appropriate hand washing, which we'll get into in chapters 2. Now, nursing assistants can also have a professional relationship with an employer by completing tasks efficiently, following policies and procedures, which we've already talked about, documenting and reporting timely and carefully, reporting problems to your nurse, reporting anything that interferes with duties, asking questions, and taking direction and feedback. And that is very important. Taking direction and feedback is going to help you grow in this profession. Being clean and neatly dressed and groomed, being on time, and that is definitely something worth highlighting. Notifying the employer if you're going to be absent. It not only shows respect, but you got to realize you're caring for one's life. And that person is who's going to be neglected when no one shows up for work. So it's very important that you notify your employer that you're going to be absent so they can begin to plan accordingly. Following the chain of command, which we talked about earlier, participating in education programs. We get a little bit more into that in chapter 10, but it's important that when they offer any type of educational programs at your place of work, it is actually required by law that you involve yourself in those programs or classes. Being a positive role model for your facility is how you earn the respect and also keep your relationship professional with an employer. Now, let's look at more qualities of a great CNA. Nursing assistants must be compassionate. You must be honest. You must be tactful, conscientious, dependable, and patient. And I must stress being patient because you're going to be working with residents who may not understand you. You're going to be working with residents who have multiple diseases and diagnoses, and it makes it very difficult for them to maybe communicate with us. So it's very important to be very patient. We're going to be working with people who have behaviors. You're going to be working with those who are confused. So it's going to take a lot of patience to work in this field. Also being respectful towards your peers, respectful towards your employer, also respectful with the resident and the residents' families. Unprejudiced and also proactive. And that's something that I really want you to highlight is being proactive. You want to be able to I actually like to call this preventative. You want to put measures in place to prevent incidents and accidents from occurring. And we're going to talk a lot more about that in chapter 2. So I want you to think about this question. How might a nursing assistant demonstrate each of the qualities that we just listed? I want you to think about that. What are some ways that you can demonstrate being compassionate, showing sympathy and empathy, being tactful? What are some ways that you can demonstrate each of those qualities? And that is definitely something to think about because that's going to help you determine, is this the right field for me? Now, let's switch gears and talk about some of the legal and ethical issues or concerns in healthcare. Ethics is the knowledge of right or wrong. Laws are rules set by the government to help people live peacefully together and to ensure safety. Nursing assistants should always follow these guidelines for legal and ethical behavior. Now, some of these things are actually a repeat of what we already talked about, but again, we stress this because this is dealing with, again, legal and ethical. So now these are things that has to legally be done. Being honest at all times, protect residents' privacy, keep staff information confidential, report abuse or suspected abuse of residents, and assist residents in reporting abuse if they wish to do so. Follow the care plan and your assignments, and do not perform any tasks outside your scope of practice. Again, these are legal things that you must do. Report all resident observations and incidents to the nurse. Document accurately and promptly. Follow rules about safety and infection prevention, which we'll talk about in chapter 2. Do not accept gifts or tips. Do not get personally or sexually involved with residents or their family members or friends. Now, I want you to define the following terms. This is going to help us really understand what resident rights are all about. The omnibus, and you can highlight this on page 11 in your book, the Omnibus Budget Reconciliation Act. which we call OBRA. Very important for you to know, and I'll tell you why. These are laws passed by the federal government that includes minimum standards for nursing assistant training. That's right. Your training is on the federal level. Your training is very important. Nursing assistant is very important. That's the reason why at the end of this program, you can receive a license. But OBRA is also responsible for staffing requirements, resident assessment instructions, and information on rights for the residents, which we'll discuss shortly. A site in a long-term care facility is to find a problem through a survey. So working in a long-term care facility, or actually any healthcare setting, every year or annually, these facilities have to be inspected by the state of Michigan because we want to make sure that we're providing the highest level of care to our residents and to our patients. And so what happens is during these annual surveys, problems can come up. And when that come up, these facilities may be cited. Sometimes the citation may be just something simple as giving them a warning, which may last for a year to 2 years. Some of these citations can actually lead to the shutting down of facilities. So it's very important to participate in a lot of those education programs in your facilities because they educate you on this process. Now, here are other terms to really help us understand what are resident rights. Resident rights are numerous rights identified in the OBRA law that relate to how residents must be treated while living in a facility. They provide an ethical code of conduct for healthcare workers. An informed consent is the process in which a person, with the help of a doctor, make informed decisions about their care. Nursing assistants should know these important points about OBRA. OBRA sets minimum standards for nursing assistant training. So your training has to be a minimum of 75 hours. Also, OBRA requires competency exam for nursing assistants. Also, OBRA requires regular in-service training for nursing assistants. In other words, 12 hours annually. So remember, I told you that you have to participate in those educational programs. And this is something that your jobs will offer to you. You have to have 12 of those hours annually, and we call those in-service training. OBRA establishes state registry for nursing assistants. So that means that you are now, once you receive your license, you're going to be listed on a state registry. And I can actually look your name and your license up. OBRA sets standards that instructors must meet in order to train nursing assistants. So I myself hold a special license in order to train CNAs. OBRA also establishes increased minimal staff requirements for long-term care facilities. They also outline minimum services that long-term care facilities must provide. OBRA sets resident assessment requirements, what is also known as MDS, and we'll talk about that at the closeout of this chapter. OBRA requires changes in the survey process, which we talked about, the annual surveys. And also OBRA outlines resident rights. Now, let's take a little look further into what resident rights are. Residents have a legal right to, and you can see these rights actually listed on page 12, which gives you a little bit more detail of what it actually means. But they have a right to quality of life. They have a right to the best possible care available with dignity, choice, and independence as being part of quality of life. They also have a right for services and activities to maintain a high level of wellness. Residents must receive the correct care. Healthcare professionals at facilities must develop a care plan for residents, and this care should keep them as healthy as possible. Residents have the legal right to participate in their own care. And also, they have a legal right to, and let me go back to participate in their own care for a second. Basically, what this is saying is residents have the right to participate in planning their treatment care and their discharge. Residents have the right to see and sign their care plans after all significant changes. Residents have the right to be informed of the risks and benefits of care and treatment, including treatment options and alternatives. Also, residents have the right to make independent choices. Residents can make choices about their doctors, their care, their treatments, all the way down to the staff that's taking care of them. They can make personal decisions such as what to wear and how to spend their time. They can join in community activities, both inside and outside the care facility. They have the right to a reasonable accommodation of their needs and preferences. And so this is the reason why we say we honor that, their needs and their preferences, because the resident is first. This is their life, this is their care. They also have a right to privacy and confidentiality. They have the right to speak privately with anyone. They have a right to privacy during care. They also have a right that all of their information must be kept private. They also have a right to dignity, respect, and to freedom. They have a right to security of their possessions. Their personal possessions must be safe at all times, and facility must make an effort to protect such possessions. They have a right to be informed of and consent to transfers and discharges. I'll give you an example. You can't just say, we're going to change your room. No, they have to consent to any type of transfers or discharges. Residents also have a right to voice complaints. And we're going to talk about shortly, if they voice complaints, who they can voice that complaint to. Not only do they voice grievances, but they have to be able to voice these grievances without fear for their safety or for the quality of care they will receive. Facilities must work quickly to address their concerns. Residents also have the legal right to have visits. They can have visits from their doctors, from family members, including spouses or domestic partners, from friends, from the ombudsman, which we'll talk about shortly, clergy members, or anybody. Visits cannot be restricted. That is the difference versus hospital and long-term care. The visits cannot be restricted, it cannot be limited or denied on the basis of race, color, national origin, religion, sex, gender, sexual orientation, or disability. They also have a right to have access to social services. And so that's why we have our medical social workers on staff at these facilities. Now, I want you to think about these questions. How can nursing assistants work to protect resident rights? I want you to think about that, okay? So here are some examples on how to protect resident rights. Nursing assistants should never abuse a resident in any way. And we're getting ready to close out this chapter. We're talking about abuse. You must report suspected abuse, involve residents in planning, always explain procedures before performing them, never unnecessarily expose a resident while giving care, respect a resident's refusal of care. So I want to go back to that. You or the resident have a right to refuse care. That is also a legal right. But you must report refusals to the nurse. And how we handle refusals of care, we usually try to offer it 3 different ways with different approaches. Sometimes I may go to a resident and say, hey, it's time for your shower. The resident may refuse. If the resident refuses, I'm going to definitely go back to my nurse. And then at that time, the nurse may go back and try. Sometimes we ask the resident, what time works best for you? Because we're honoring those preferences. But any refusal of care must be reported to the nurse and it must be documented. Also, nursing assistants protect the rights by telling the nurse if a resident has questions, concerns, or complaints about their care. Also, to protect resident rights, nursing assistants should be truthful when documenting care, not talk or gossip about residents, knock and wait for permission for entering a resident's room, not accept gifts. And again, some of these things are considered like a repeat. Also, not open, this is very important, not open the mail or look through the belongings of the resident. I must tell you that there was a situation where a nurse was fired because this person actually used the cell phone charger of a resident without the resident's permission. And so because of that, that is dealing with the resident's personal possessions. And so if you're, not respecting that, you're not asking, then that can become a problem. We're going to talk about that shortly. In order to protect the resident rights, you as a nursing assistant should report observation about residents' condition and care, and then also help resolve disputes by reporting them to the nurse. So think about these questions. Would everyday decisions seem more important to you if many of your choices were taken away? I want you to really, really think about that, because these residents are moving from a place of being familiar. It could be their home, it could be with their loved ones. And so a lot of the decisions and choices that they made every day could possibly be taken away. Why do you want to make your own decisions? I want you to think about that. And how does this exercise relate to resident rights? These are just some things to either trigger a discussion or just some things to think about. So always remember, residents have the right to make their own choices. Now let's continue our discussion on resident right. And now let's look at abuse. And so I want you to highlight very, very important, starting on page 14, I want you to begin to highlight some of these terms as it relates to abuse. This is important. I have to stress this because you're getting into an environment where we're working with a vulnerable adult. And so abuse happens many times. In fact, this is the reason why a lot of your residents do not like to enter into these facilities, because they hear of rumors of abuse. They see these things on the news. So it's very important to understand each term and what is your role as it relates to abuse. So abuse is purposeful mistreatment that causes physical, mental, or emotional pain or injury to someone. Physical abuse is any treatment, which is intentional or not, that causes harm to a person's body. For example, a physical abuse could be hitting, shoving, but most importantly, we see a lot of what we call rough care or rough handling. Psychological abuse can also be called mental abuse or emotional abuse, is emotional harm caused by threatening, scaring, humiliating, intimidating, isolating, or insulting a person, or by treating them like a child. Verbal abuse is the use of spoken or written words, pictures, or gestures that threaten, embarrass, or insult a person. Sexual abuse is non-consensual sexual contact of any type. Financial abuse is the improper or illegal use of a person's money, their possessions, which we've spoken about, their property, or other assets. Assault is a threat to harm a person, resulting in the person feeling fearful that they will be harmed. So for example, if you threaten to say, if you don't come take your bath, I'm going to slap you, that is an assault. But battery is the actual or the intentional touching of a person without their consent. So assault is to threaten them, but battery is to actually do what you threaten to do. Domestic violence is physical, sexual, or emotional abuse by spouses, intimate partners, or family members. False imprisonment is the unlawful restraint of someone that affects a person's freedom of movement, includes both the threat of being physically restrained and actually being physically restrained. We'll talk later in chapter 7 about restraints. Involuntary seclusion is the separation of a person from others against the person's will. I'm going to talk a little bit more about false imprisonment. I had a situation where there was a resident who enjoyed getting out of his bed and putting himself into the wheelchair, going to the hallway, and then going back to bed. He did this several times an hour. The problem is every time he got up, it caused those bed alarms to go off. Some facilities still actually do have bed alarms. So I witnessed a nursing assistant. We were actually on clinical site. I witnessed a nursing assistant take his wheelchair, close it up, and put him in the bath, and put the wheelchair in the bathroom, which means that now the resident is unable to get up. So really, you just kind of created false imprisonment. Workplace violence is verbal, physical, or sexual abuse of staff by other staff members, residents, or visitors. Sexual harassment is any unwelcome sexual advance or behavior that creates an intimidating, hostile, or offensive working environment. And substance abuse is the repeated use of legal or illegal substances in a way that is harmful to oneself or others. Neglect, and I wish that you would highlight this on page 15, neglect is the failure to provide needed care that results in physical, mental, or emotional harm to a person. Negligence is the action or the failure to act or provide the proper care that results in unintended injury to a person. I really want to spend some time with neglect, because if we fail to do a certain thing and it causes now physical, emotional harm to a person. I'm going to give you an example. We had a resident's family who constantly complained that the resident was losing weight. So state of Michigan came into the facility, went to review the chart of that resident, and discovered that it was never documented that this person ate none of the meals. And again, documentation falls on us as nurses. Documentation also falls on nursing assistants. And so the part that resulted from the harm is that that person was actually losing weight. So even if we came back to say, well, wait a minute, we see her eat every day, we just didn't document it. Well, if you fail to document it, it didn't happen. And that's considered neglect, because now we have a person that is losing weight. Malpractice is injury to a person due to professional misconduct through negligence, carelessness, or lack of skill. So let's look at these suspicious injuries. The following injuries are considered suspicious and should be reported: any type of poisoning or traumatic injury, teeth marks, which is your physical abuse, your belt buckle, strap marks, bruises, contusions, welts, scars, fractures, dislocation, burns, especially cigarette burns, scratches, scalp tenderness, swelling of the face, broken teeth, bruises, bleeding, or discharge from the vaginal area. We're looking at physical abuse, and even some of this can be sexual abuse. Other signs of abuse that indicate abuse includes yelling, fear, apprehension. So now we're looking more of an emotional abuse, poor self-control, constant pain, threatening to hurt others, feeling withdrawal or apathy, meaning not wanting to participate in activities. Again, we're looking at emotional and mental abuse, alcohol or drug abuse, which is more of your substance abuse, agitation, anxiety, or signs of stress, which is could also be mental or psychological abuse, low self-esteem, mood changes, confusion, private conversations are not allowed, or the family member or caregiver is present during all conversations. We have to be very, very careful of those things. And then also reports of questionable care by a resident or their family. Now, signs of neglect. Signs that can indicate a person is being neglected is pressure sores, or also called bed sores. And we're going to get a lot more into that in chapter 6. Unclean body, poor hygiene, body lice, unanswered call lights. That is a sign of neglect. We'll get a little bit more into call lights in chapter 2. Soiled bedding or incontinence briefs or adult diapers not being changed. Clothes are not fitting. Needs are not being met. For example, their eyeglasses are broken. Their hearing aids are not working. This is all considered signs of neglect. Weight loss, poor appetite, food not being eaten. They're dehydrated. They don't have water or beverages offered to them frequently, and their reports of not receiving prescribed medication by resident or their family. These are all signs of neglect. So who is vulnerable to abuse and neglect? Some people are more vulnerable to adult abuse or neglect than others. They include the following: elderly people, people who have a physical illness or are disabled, people who are developmentally disabled, people who have mental health disorder or a condition, people with communication problems such as hearing, speech, and vision impairments. All of these people have a few things in common that make them so vulnerable. They are often unable to stand up for themselves or to report abuse or neglect to others. They may not even understand that they have rights. Often, these people can be much more demanding to care for, which increases the stress that caregivers have to deal with. So caregivers may not have been properly trained to care for these particular people. And so that's why you're here today. And they may not understand why these people behave the way that they do. Caregivers may also be overworked, tired, stressed, and unappreciated, on top of caring for someone who requires so much time and energy. So these are the people who most need your help and protection from harm. They may not be able to speak for themselves, but the signs of abuse and neglect may speak volumes for them. Know how to recognize these signs. So think about these questions. Why are these people so vulnerable? And how are resident rights related to abuse and to nursing assistants' responsibility to protect residents from abuse? And always remember this: nursing assistants must never abuse residents in any way and must report any suspected abuse right away to your nurse. Reporting suspected abuse is the law. Nursing assistants must follow the chain of command when reporting abuse. Now, there are some instances where some people may not want to report abuse to nurses or to anyone in a facility. You can actually make the call yourself. And so once we get onto our clinical side, I'm going to begin to show you how you can actually make that call. Now, as we continue our discussion on resident rights, let's look at some resources that are available to residents. I want you to highlight this term in your book on page 16. It is called the ombudsman. The ombudsman. The ombudsman is a legal advocate for residents in long-term care facilities who helps resolve disputes and settle conflicts. These are the typical tasks of an ombudsman. They advocate for resident rights. They educate consumers and care providers. They investigate and resolve complaints. They may even appear in court on behalf of the resident. They work with investigators and they give information to the public. So these people kind of act again as an advocate for residents who want to voice grievances or complaints. Now, facilities often have resident councils, which exist for these purposes. Resident councils is a team or a group of residents that meet regularly to discuss issues related to the care facility. They also give residents a voice in facility operations. They provide a forum to discuss policies, activities, concerns, and problems. They allow residents to provide suggestions on improving the quality of care at the facility. Now, here are some terms on page 17 as we're closing out this chapter that I want you to become familiar with. Confidentiality is the legal and ethical principle of keeping information private. Have you heard of the term HIPAA? HIPAA. That is Health Insurance Portability and Accountability Act. That is a federal law that requires health information be kept private and secure, and that organizations take special steps to protect this information. So when you're going to these doctor's offices and appointments, make sure you know what you are signing. Then you have protected health information, or PHI. This is the information that needs to be kept private. A person's private health information, which includes their name, address, their telephone number, social security number, email address, medical record number, their diagnoses, their room number, all of those things. So remember, HIPAA applies to all healthcare providers, including nursing assistants. Serious penalties can be imposed for not adhering to HIPAA guidelines. Now, these guidelines are essential to protecting residents' privacy. How do you protect the privacy of your resident? Listen to or read messages in private areas. Know with whom you are speaking with on the phone. So for example, you may be involved in answering the phone at your workplace. You definitely want to be careful with who you are giving information to. We want to make sure that these people that's asking questions about the residents, that they have the right to receive that information. And we'll find a lot of that in the residence chart. Do not talk about residents in public. Use confidential rooms for reports to care team members. Be careful greeting residents, family members in public. Do not bring family or friends to the facility to meet residents. This is something that I actually do see quite often happen. Make sure health or personal information on a computer screen is not visible to others, and be sure to log out after finishing your computer work. Do not give confidential information in emails. Do not share resident information, photos, or videos on any social networking site. Make sure that fax numbers are correct before faxing, and use a cover sheet with a confidentiality statement. Do not leave documents where others may see them. Store, file, or shred documents according to facility policy. If you find documents with the resident information on them, give them to your nurse. So think about these questions. How does confidentiality affect a nursing assistant's use of social media, like your Facebook, Twitter, Instagram, or TikTok, for example? I see this a lot, especially on TikTok, making videos with residents, nothing harmful, but again, we're invading privacy. What would be illegal use of social media? So that's something to really, really think about. Is everything that is legal also ethical and professional? So these are just some questions for you to think about. As earlier, I mentioned one of the CNA roles of documentation. So let's look a little further into this role. Careful, timely documentation is important because it guarantees clear and complete communication. It provides a legal record of treatment. It protects the nursing assistant and employer, and it also provides an up-to-date record of the resident's status. But what I want you to remember, if a nursing assistant does not document care, legally, it was not done. So that's why documentation is so important. Nursing assistant must follow these guidelines for documentation. Document care immediately after it is given. Do not wait till the end of your shift to do it, because that's where errors do occur. Think before documenting, be very brief and clear. Use facts, not opinions. For electronic documentation, which the majority of your facilities do have, facilities will provide training. Legal documentation rules will still apply. HIPAA guidelines do apply. Do not have someone else enter information for you. In other words, do not share your password or your login information. Make sure to log into the correct chart. Log out when you are finished. Double check autofill entries. Treat computers carefully, and do not access personal accounts on facility computers or devices. And nursing assistants must follow these guidelines for documentation. Use black ink when documenting by hand. Correct errors properly. Sign full name and title, and document according to the care plan. So when you are documenting or correcting errors, one thing we don't do is we don't scribble or white out in any chart where you're documenting by hand, but we normally will draw a line through it and initial, because think about when these things go to the court of law, you don't ever want to look like you're covering up anything. Now, this is just an example of what we call a military time clock or a 24-hour clock. The purpose of this is because when we document in healthcare, we use the 24-hour clock or the military time clock. So in order to understand this, it's very important to just become familiar with it. So for example, this is your AM. The orange or the outer area here, the orange area, this is your actual clock. And then the grayed area here is the PM. So let's say, for example, if it's 9 o'clock in the morning, we see here it's 9 o'clock, 0900 hours is considered AM, but 2100 hours is considered PM, okay? Same for 8 o'clock, okay? 0800 hours is 8 o'clock, okay? 2000 here is considered 8 p.m. Okay, so best way to really understand military time is you got to kind of memorize it. Okay, while looking at the key material, explain how to convert regular time. This just kind of gives you some pointers on how to do that. And you can see this example on page 19. And then lastly, minimum data set, what we also know as MDS, is a detailed form with guidelines for assessing residents in long-term care facilities. So nursing assistants should know the following about the MDS. It helps nurses complete resident assessments accurately, details what to do if resident problems are identified. It must be completed for each resident within 14 days of admission and again each year. It must be reviewed every 3 months, and a new MDS must be done when there is any major change in a resident's condition. But remember, nursing assistants have a key role in observing and reporting resident changes. Nursing assistants' observation can trigger a new MDS to be completed. So ensuring the resident receives the best possible care. This is why I cannot stress to you enough, documentation is important. In addition to documentation, you may be involved in incident reporting. An incident is an accident, problem, or unexpected event during the course of care that is not part of the normal routine in a healthcare facility. All of the following events are considered incidents: a fall, which we'll talk about in Chapter 2, damage to facility equipment or resident belongings, mistakes in care, requests outside the scope of practice, sexual advances or remarks, anything that makes a nursing assistant feel uncomfortable or unsafe, injuries, blood or body fluid exposure. So when making an incident report, the nursing assistant should tell what happened, describe the person's reaction to the incident, state facts only, and do not document that an incident report was completed on the medical record. And then also describe the action that was taken. Well, I hope you have enjoyed Chapter 1 with learning the nursing assistant's role in long-term care. And remember, I hope you took plenty of notes to study for this. Go back to the areas that I've asked you to highlight, and also be prepared to take your quiz and to complete your worksheets. I will see you again in Chapter 2.